Aloha and welcome back to the Puna Strong Virtual Resource Fair. We are super excited to have you all joining us today, as well as Kumukahi Health and Wellness, who you might know as the Hawaii Island HIV and AIDS Foundation, or HIHAF. They recently did a rebranding and are now known as Kumukahi Health and Wellness. We're super excited to welcome Peter Silva, who is the Executive Director of Kumukahi Health and Wellness. He's a proud graduate of St. Joseph High School and the University of Hawaii at Manoa, and has worked in the public health field for over 23 years. His team is also here with him today, and we have Rochelle Hanohano, Christine Capiojo, Kiva Lay, Kyle, Cindy Medeiros, and Phil Russell. Welcome so much, and I'll turn it right on over to you, Peter.
Steve, thank you so much. We're so excited to be here today, especially doing this for our Puna community. We love our Puna community. A lot of us have ties there, live there. We've been serving the community for over 30 years. So this is a great opportunity for us to share what we do and let folks know all the great work and the great people that we have here at Kumukahi. So I'll do a quick introduction. I'm Peter Tui Silva. I'm the Executive Director. So I'll pass it over to Kiva.
Aloha, my name is Kiva Lay Kadina. I'm the Harm Reduction Services Manager here at Kumukahi Health and Wellness.
And Phil.
Hi, my name's Phil, and I'm part of the POA team that does prevention and outreach.
Rochelle.
Aloha, everyone. My name is Rochelle Hanohano, and I'm the program manager for the Kokua Services Partnership. And I've been with HIHAF and the Kumukahi Health and Wellness since 2013.
Kyle.
My name is Kyle Furman. I am the medical director at Kumukahi Health and Wellness.
Awesome. And we'll turn it over to Ms. Cindy Medeiros, who's been with us for over 20 years.
Aloha, everyone. My name is Cindy Medeiros. I am the Director of Operations here at Kumukahi Health and Wellness.
So glad you folks can meet the team. I'm going to have Cindy go over a little bit of our history here at Kumukahi Health and Wellness.
Aloha, everyone. Thank you for allowing us to be here today with you folks. Just a favorite memory of Puna for me has been the fact that I've always been a city girl, lived in Hilo, and my parents decided to build a home out in Mountain View, where I was able to grow up a little bit of my adult life there. So just being able to move out there really gave me a sense of what community is. The neighborhood my parents decided to build their home in is a very close-knit community, you know, borrow a cup of rice or a cup of sugar, you know, that type of thing. And it's just been amazing just being able to be a part of that type of community and be able to see my grandchildren even grow up there too. So, you know, Puna has really deep roots for me and the rest of my ohana. As part of Kumukahi, the history behind it is that it was a Hawaii Island HIV/AIDS Foundation was a merger between the Big Island AIDS Project in East Hawaii and then also West Hawaii AIDS Foundation in Kailua Kona. We do have 2 offices, like I mentioned. This is such a big area that the Big Island covers, but the big part of our East Hawaii office was that we were able to move that office. Once we merged, we moved out to Kea'au. We realized, you know, for our East Hawaii office, there was a lot of our clients living out in Puna, and, you know, transportation is such a hard thing for everybody. So that kind of gave them easier access, but not be too far away from Hilo, and still they could reach us and still get the medical care they need, get the case management services they need as well, in addition to the other services in our prevention department. And now we are Kumukahi Health and Wellness, and, you know, expanding services to where we are now, being able to have a sexual health clinic, our medical insurance navigation program, our prevention and outreach programs, we get to reach folks and meet them where they're at. So I'm really proud to be a part of this program. We do amazing work and we are part of this community, and just being able to see clients and just especially for Puna, it's so big, the area is really large, but we get to do the services we do and be part of that community.
Awesome. Thank you so much, Cindy. And as far as introductions, also I want to introduce Christine of PEO.
Aloha, everyone. My name is Christine, and I am Director of Client Services here at Kumukahi Health and Wellness.
A very important part of what we do. I want to say one of my favorite memories is definitely behind me is Kapoho, spending summers in Kapoho, but also waking up on my tutu's house at Honu Street in Hawaiian Beaches and just hearing the birds and the chickens and eating my Vienna sausage omelet with her. That's one of my most cherished memories of Puna for sure. We're so glad that you're here to get to know us today. We certainly do have a lot of different programs, and I'm glad that I have the folks here to explain those programs. We rebranded on August 11th, and we actually took on the name Kumukahi for our own organization. And as you know, Kumukahi is not only a special place to Puna, but it's a special place to the Big Island, and it's a special place to the state of Hawaii. It's where the sun first comes up. It means one source. And we were able to go out there and to pay homage to using that name. Back in June, I believe it was, we worked with Tracy and Naimi to record our blessing. And it was really us, you'll get to see giving the whole kupu, which was a symbol of HIHAF, giving that back and letting that name live on in the universe and taking on Kumukahi Health and Wellness. It was a very interesting day, interesting idea, I should say. I had to told the staff, let's meet at 2:30 in the morning and then hike out at 8:30. But you'll see in this video, it really captured who we are and what we do and our intentions in using Kumukahi in our name to help our people. And it's really not erasing HIV, it's an embracing HIV, but it's focusing on the people rather than focusing on the disease. So what I'm gonna do is share our video of Kumukahi Health and Wellness. So give me a sec to put this together.
In the beginning, everyone was scared. People felt alone. People were sick with a virus that no one understood.
It was during this time a few Hawaii Island residents banded together to help their friends and ohana, losing the battle with AIDS, to have a death with dignity and aloha.
This is how we started 35 years ago.
We have grown from a small support group of folks providing end-of-life care to an island-wide agency with nearly 30 staff and volunteers to help educate our community, provide life-saving services for some of our most vulnerable people across our island, our state, and the Pacific.
We heard from our clients and our community members that the words HIV and AIDS creates a barrier for them to come through our doors. So we took a hard look at our organization and decided to make a change to make it easier for our community to come to us to get the care that they need.
We also realized that our communities needed to know that we are much more than HIV. We've used what we've learned from this epidemic and applied it to other health disparities that affect our families here in Hawaii.
Kumukahi is the perfect place name for us because it uniquely identifies us as being from Hawaii Island. Kumukahi is the easternmost part of Hawaii Island, where the sun rises and where the sun rays first touch the Hawaiian universe. Kumukahi also means origins or beginnings, which reminds us of who we are, where we've come from, and what our mission is. We always remain mindful of the beginning of the AIDS epidemic and what it looked like, and of our own history in order to move forward.
We chose Kumukahi Health and Wellness to emphasize the holistic nature of our services. We serve as a safe place for Hawaii's most vulnerable populations living in the most rural and remote areas of our state.
We use the representation of the va'a to symbolize our individual roles, which working together moves us into the future of the health services for Hawaii Island.
Iola Sexual Health Clinic provides many different services, unique services to the people that live on the Big Island. The primary one is HIV care.
We also do Hep C treatment.
We take care of our transgender population by providing gender-affirming services to them as well.
Through Department of Health, we do free STD testing and treatment.
We provide pre-exposure prophylaxis or PrEP to high-risk community individuals. We also treat post-exposure to HIV.
For our MMA community, we provide services that they can't get elsewhere.
We have a really interesting program here that a lot of people don't know about. We actually have a mail order pharmacy where we can send your medications directly to your door 90 days at a time.
If you have no insurance, we have people to provide connections to insurance.
And we have support groups. Two of them right now. One is our HIV support group, and we also have a transgender support group that occur every week.
My name is Rochelle Hanohano, and I work for the Kokua Services Partnership. Our job here is to sign up members of the community that are uninsured through either the state MedQuest program or the federal marketplace.
Health insurance is important because it provides a safety net. If you were to get unexpectedly injured or some kind of an illness, it's most likely you won't be able to pay out of pocket for it. So what it does, it helps to lessen the financial burden for any of those type of costs.
Client Services provides 4 core services areas. Number 1, first and foremost, is an HIV specialist connection to that individual. Next thing is always access to HIV medicine, which can be very costly. Next one is food pantry, always, and then as well as housing subsidy assistance.
The overall goal of case management and client services is to help someone get virally suppressed, and we know that it takes a lot more than just getting somebody medications and access to a doctor. It takes a lot more, and that's the overall purpose of our programs.
Our harm reduction services include things like syringe exchange,
PrEP navigation services,
HIV, hepatitis C, and STD testing,
social services to teach our communities about safer sex practices.
It's really, all of the programs are really based around community engagement. Is our ability to reach into the community, recognize that there's different types of lifestyles and a diverse amount of communities that we work in, and recognizing the risks in those communities and helping people do things a lot safer.
We still serve those living with HIV, which is why we chose to keep the red ribbon in our logo. But we also want anyone and everyone to feel comfortable coming through our doors.
We will continue to answer the call of our people. We will continue to lead with the knowledge of our ancestors, coupled with the latest in medical breakthroughs and scientifically accurate information. We will continue to be the voice and the safety net for those who tend to get lost in our systems, our not so neatly defined boxes. We are the future of health and wellness. We are Kumukahi Health and Wellness.
All right. Wow, I get chicken skin every time I see that. Thank you so much. As you can see, it was quite a journey to get there, but all worth it. At this time, I'd like to feature the stars of that show that you just saw. And we'll go right down the line so that you can hear a little bit about what they do and what services we do offer to the Puna community. So I'm going to start with Kyle.
Hey everybody, I'm going to share my screen really quick. It's a very brief little slideshow, but something that I just put together to talk about what we do as the Sexual Health Clinic. So probably my favorite memories of Puna, I'm still making them, I guess. I'm spending more time down there recently. Obviously, Kahena is beautiful, especially at sunrise. I enjoy going down with friends to the lawn at Seaview and just eating dinner and watching the sunset. That's one of my favorite things to do. We do have so many connections to Puna, and it's an important part of our community, of course, on the Big Island. I'm the medical director at the Sexual Health Clinic here. We've been open for about 1.5 years, going on 1.5 years. And in that time, we've established many programs that I think really have made a positive impact on the health and well-being of our community. So there's a group of us. This is our group of 4, and I'll introduce them a little bit later. But these are the people that you'd be interacting with if you do come into the clinic. All of them have been handpicked and carefully selected and are wonderful at what they do. So our services are actually quite extensive and necessary. Number 1 is our HIV medical care specialty clinic. So we are nationally recognized as an HIV specialty clinic, myself as an HIV provider, and that is our primary focus. We see many people who are living with HIV and many people who are in communities where they interact with people that are living with HIV. We offer PrEP services, and I think Keith will probably mention that later, but we do PrEP prescriptions and monitoring to keep you safe in your sexual practices. We offer gender-affirming care for our trans and non-binary communities. We have quite a large patient population that is in this part of the clinic, and we're very, very excited to be able to offer that as part of our care here. Just to mention it, I know we're focusing on Puna today, but we offer these services on both sides of the island. So if you're watching this from some other place on the Big Island, just know that we can also take care of you. So the gender affirming care piece is a big part of what we do here. Generally, we try to be very sensitive to our LGBTQ community and try to make this a very welcome and safe space for them. So we offer that service as well as men's health. We know that there's, a lot of women's health services, OBGYNs and whatnot, but, men have their own healthcare needs as well. And so we offer services to really support men in their overall health and their sexual health. And like I mentioned in the video, we have a mail order pharmacy for people who qualify. And that is really quite something, especially for people who live in rural parts of the island where they don't have to make trips into town to go to the pharmacy every month to pick up their medications. We can send them directly to you through our pharmacy with a 3-month supply at a time. So really briefly, this is our team. Myself, I'm an APRN and board certified as a family practitioner, also certified as an HIV specialist. My nurse is BJ Crivello. She's an RN and a new part of our team and just absolutely wonderful to work with. Shara Martins is probably going to be your first contact if you call. She is an incredible part of our team and really is the face of our clinic. And we also have Missy Kanemitsu, who works a little bit in the background, but you'll probably see her around. She's got a great smile and is a wonderful part of our team too. So that's a little bit about us, and I'm going to pass it right back to Peter.
Awesome. Thank you so much, Kyle. Great work that they do. I also now would like to pass it on to Rochelle Hano and her team.
Aloha, everyone. I'm so blessed to be a part of the Kumukahi Health and Wellness agency. I think that we provide such a wonderful service for our community. I have a great team here at Kumukahi under the Kokua Services Partnership Program. We have Paul Tome, Melanie Matsumoto, and Rachel Cuba. And we also have partners on the Big Island, which is the Island of Hawaii YMCA, Kalani Hale, and West Hawaii Community Health Center. And we also have partners on Maui Imua Family Services and Malama Ikeola Health Center. My favorite memory of Puna is when, we're growing up. My parents used to always take us down to Queen's Bath on the weekend, and we used to go swimming. And Black Sands Beach is my most favorite beach ever. The memories that we had there of Kaimu was just incredible and so breathtaking. The services that we provide to our community is we service the community that is underinsured. So we are the leader under the MedQuest contract that we have, and we assist those that do not have health insurance. So if they meet the eligibility requirements for MedQuest, then we sign them up for that program. And if their income exceeds the limits, then we sign them up for healthcare.gov, which is a federal program that also helps with assistance. We specialize in servicing our LGBTQ community, the recently released from incarceration, farmers, self-employed, members of our community, as well as the COFA population. And so if you know anyone that needs any assistance, please come by and give us a call. We provide a free service to our community, and we also service the entire island. So just feel free to call us. Mahalo.
Awesome. Thank you, Rochelle. That's great. I just want to share with you folks really quickly how you can sign up for any of those services. You just go to kumukahihealth.org. You enter the site, and here you can just make an appointment, put your name, phone number. What are you looking for? Health insurance, STI testing, HIV care, PrEP, trans care, and then put your times. And once you submit it, it goes to Shara, our front desk person, and she can link you up with any of these appointments that we are talking about today. So at this time, I would like to turn it over to the lovely Christine Oho. And really the core of everything we do is her department. So, Christine.
Aloha, everyone. Thank you, Peter. I have a great case management team. Again, I'm Director of Client Services here at Kumukahi Health and Wellness. And we have a team of case managers here that are servicing both sides of the island, Hilo side as well as the Kona side. So on our Hilo team, we have David Deegis, Terry Ann Faria, and Beverly Zigman. And on our Kona side, we have Bernadette Haleamau and Kekoa Kealoha for Kona. So we're here to make sure that folks have access to case management services. So it's really straightforward to be able to access us. You don't have to have a referral. It's really for anyone living with HIV and who is needing our core services. So the intake process is really straightforward. All you have to do is pick up the phone and call, and of course Shara is going to answer. She's going to direct you back to myself as Director of Client Services, or really anyone here in case management, and we can set an appointment for you to come and do an intake. And intake is fairly straightforward. It takes about an hour. There's paperwork involved like anything, but it's just starting out with your identification, as well as if you have some income, we're here to qualify you for the program. And I guess utilizing Ryan White funds as well. So I forgot to mention my most favorite part of being in the Puna area is, again, that chance to be able to go out to Kumukahi and see the sunrise as part of the team. That was amazing. And I took the time out before that happened to actually go and ride my bicycle out there with Kiva. So that was super special. The area is absolutely incredible. So we really, again, as a team, want to serve our Puna community and be there for folks. And for case management, I know that you saw in the video, but there's just, again, those super core areas for case management that we're going to concentrate on to make sure our individuals have the best health care while living with HIV. And that is always access to an HIV specialist, access to HIV medicines. We have our food pantry in, again, both of our offices, Kona and Hilo, and you can access that by, once you're qualified into our program, you can call us up and be able to access the food pantry once a week, which is wonderful. And then as well as we have rental assistance, which is amazing. And also you qualify and can access that rental assistance through case management. And then last but not least is really the financial component of being able to get some financial assistance for things like invoices for dental care or co-pays for your HIV medicines. That's another area that we can help with financially. So really a great team so that we can make sure that we serve our Puna community and that we're making sure that they have access to super core services that helps them with their health. I know that what we've done out in that area in the Puna community is that we've gone out to Pahoa area and we've actually stayed out there. We've delivered food, hot food to folks. And then right now we're preparing holiday meals so that we're touching base with all of our clients to see who would like a holiday meal and how we can get that to them. So it's really a core part of our foundation and our agency, and we're very proud, and I feel very fortunate to work with the colleagues here together for this event. So I'm going to pass it back to Peter.
Thank you so much, Christine. Such a great department, and
thank you.
Such great work that you folks do. Definitely appreciate it. I'd like to turn it over to Phil, one of our leaders in the East Side LGBTQ community that has recently come on board to help us in our prevention, outreach, and education department and our case management department. Take it away, Phil.
Hi, my name is Phil Russell. I'm part of the POA team that does prevention and outreach. My favorite memory of Puna happens every time I'm heading out to Kalapana and you're driving and then you turn that bend and then you just see the ocean glittering in front of you and it's like sparkling like diamonds, and every single time it takes my breath away. So I love Puna. It's a very beautiful, magical place. I have many other fond memories of it that I can't talk about on Zoom. I'm here to tell you about the BRADA Sister Project. BRADA stands for Bradas Reinforcing Awareness Dealing with Drugs, AIDS, and Health. And SISTA Project stands for Sisters Informing Sisters about topics on AIDS and health. These are culturally based sex and health education programs focused on youth and people at risk for HIV, AIDS, hepatitis C, and other STIs. Some of the focuses of the session include ethnic and gender pride, HIV, AIDS, Hep C, and STD prevention and education, behavioral self-management, assertiveness skills training, increasing your mana, and letting your light shine. If you're interested in learning more about this or signing up a group, you can call the Hilo office at 808-982-8800 and ask for Jewel or Phil, or email me, Phil, P-H-I-L-L, at kumukahihealth.org. Back to you, Peter.
Thank you, Phil. What wonderful memories those must be. At this time, I'd like to turn it over to our program manager for our harm reduction services, Ms. Kiva Lekadina.
Aloha. Again, my name is Kiva Lekadina. Most people just call me Kiva. I'm the harm reduction services manager here. I have the honor and pleasure of working with the POA team, prevention, outreach, and education across the entire island, including the Puna area. My favorite memory, I have a lot actually, but my favorite memory of Puna was a few years back, just before the Leilani lava flow. We had our family reunion in Poho'iki, and my mom and most of her 9 brothers and sisters, and all of my cousins and all of our cousins and cousins and cousins gathered together at Poho'iki for our family reunion at the Little Red Hale, which has belonged to my family since the days of Kalakaua. And there's a lot of great memories that were made just before that landscape changed. And so whenever I go down there, I just remember all of our little kids, our babies and our keikis swimming in that little pond at the boat ramp. And my second favorite memory is when we bought our house in Waiakahi Ula, which is also known as Hawaiian Beaches. And it's our family home where I live there with my mom. So I am a Punatic myself. And yeah, so there's many more memories to be made in our home in Puna. As far as our programs here within the Po'e team at Kumukahi, I'm really proud of what we have going on across our island and in the Puna area. I'll start out with our LGBT services. We do things like support and navigation, health navigation for people who identify as LGBTQIA+, and all the rest. We also have a transgender services program where we can assist with name change process, as well as legalizing your documentation with your gender marker and amending birth certificates. We can offer a lot of support around the transition process. We also have support groups specifically for women with HIV as part of that SISTA program. It's based for support and empowerment and education for women who are living with the virus. We also have a general HIV support group that's for anybody who is living with HIV and needs that extra support and that safe space to have conversations around living with HIV. And then we also have a transgender support group. And it really is, because Hawaii Island is such a spread out place, it's a perfect way that we can come together virtually on Zoom, as we often do these days, to be able to discuss sensitive topics around transitioning and living as a transgender person, such as myself. So I'm really proud of those groups. Some of our harm reduction services, for those of you that may not really understand what harm reduction is really meeting a person where they are, understanding that people make choices and people have their lifestyles, and we're not here to change anyone's choices or change their lifestyle, but really help understand the risks around certain choices and how to reduce that in the most effective and safest ways. And so all of these programs are really based on reducing risks in people's lives. So other harm reduction services we do rapid testing for HIV and hepatitis C. And luckily for everybody out in Puna, we can also do mobile testing. So if you reach out to us through our website or you call into our office, we can come to you and offer you a rapid HIV or hepatitis C test. You would get those results in just about 20 minutes. And you'll meet one of our amazing outreach workers that can really counsel you and to see what other services we could provide here at our offices. We also do condom distribution in the Puna area. Right now we are in Airi, Hawaii and in Jungle Love. And we're looking to distribute condoms, free condoms, in other places of business around the Puna area. So if you're interested if you're a business or you have a social group and you're interested in distributing condoms for us, you give us a call and we can come and deliver a package to you. We also can link you to mobile syringe exchange services for people who may use injection needles. Our friends at Hawaii Health and Harm Reduction Center, they do outreach across the Puna area, exchanging syringes, and we have their schedule and we are in close contact with them to help navigate you to them. And then we also can link you to PrEP. You've heard that a few times in this presentation. So PrEP is actually a prevention medication for HIV. I personally like to call it like the birth control pill for HIV. So people that find themselves that are at risk for exposure to HIV or possible exposure, if this is a medication that you can take daily and it can prepare your body in case there's an exposure, your body would know what to do to fight it off and keep you safer. We can help navigate you to our Iola clinic with Kyle and his team. And we can also help you with copay assistance by navigating you through different programs that help pay for the cost of this prevention medication. And lastly, we also do some capacity building around Naloxone and Narcan. Naloxone is an emergency treatment for opioid overdose. And we are certified to train you to use naloxone or to carry naloxone so that you can help someone who may be experiencing an overdose on opioids. We've already been in the Nanavale housing community and also through the Kanaka Ha'aheo food pantry team that goes across Nanavale and Hawaiian beaches. And we distribute naloxone to them so that if someone in the community may need it, they know where to find it, and it's free service, and we can train you for free as well. So there's a plethora of harm reduction services that we can provide you. And we're happy to come out to Puna anytime of the week to tell you more about our services. So thank you for listening. Appreciate you. Aloha no.
Mahalo, nui, Kiva. Awesome services. So proud of you. So proud of the whole team. We have as you can see, we have a really great and dynamic team. We're gonna open it up to questions, but I definitely just wanna mahalo everyone for being with us today. Cindy.
Thank you all so much for sharing your knowledge and for sharing your programs. The information that you provide and the services that you provide to the Puna community are really invaluable. We do have a few questions, and I think that this first one could maybe go right to you, Peter, or maybe if you want to redirect it, that's okay too. But we've talked a lot about this different services that are available for people who are LGBTQ. Do you need to be an LGBTQ person to have access to your program services?
No, not at all. We service everyone that walks through our door, especially those that have a hard time reaching, getting services. We come out to the community. It can be you can be from any walk of life, and we definitely welcome you to our group.
That's wonderful news for everybody. And I think that this next one should maybe go to Kyle. But when should somebody be screened for HIV or AIDS? What kind of symptoms should they be on the lookout for, or what kind of behavior should they be cautious of and say, you know, I really should go in for that screening?
Yeah, I think maybe I can tag team this with Kiva because I'm sure she has maybe some things to say too. But recommendations are that everybody pretty much until you're 65 should be screened for HIV at least once in your life. So that's the very bare minimum. Women who are pregnant should be screened in their first trimester, and that's something their OB will do. And for the general population, frequency is largely based on your risk factors. But if you're sexually active, you should be getting tested. I usually say at least once every 6 months, or if you have a possible or known exposure. Kiva, do you have anything to add?
Yeah, sure. I'm a believer of normalizing HIV and healthcare. I think it's important that everybody should be tested and be aware of risks that may put that person at a higher exposure rate to HIV. Definitely transgender, men who may have sex with other men, people who use injection needles, all should be tested regularly, at least every 6 months. And it's a free service that we provide. We can also provide capacity building on HIV itself around what to look for, how the virus is spread, how to treat it, what the virus really does. I think there's a lot of different stigma around HIV, and we really want to take opportunities to have really important conversations on how to reduce that stigma and really help educate the community that it is a treatable virus and that people live long, normal, healthy lives. It's a preventable virus, and we're really working hard to make sure that it's a regular topic of conversation for people who may be at risk for HIV.
You also mentioned, Keith, a little bit about symptoms or situations. So something that I don't think we talk enough about in in our community healthcare systems is something called post-exposure prophylaxis, which is after you have a likely or known exposure. You can be put on medications in the first 72 hours after that exposure that really drastically reduce the risk of an established HIV infection. So that's something that people may not know is available, that if you have that exposure, or you're very concerned that you do, you can be put on medication for 28 days that will reduce your risk of having an established HIV infection by a really astronomically good number. So putting that out there to the community, I think is important, that they know that that's an option, but it's also a time-sensitive option, and it has to be started within 72 hours. Additionally, I think that it's important to tell people what the signs and symptoms are of an acute HIV infection, which is when you've been exposed and your body is starting to try to fight the virus off. And that looks a lot like the flu. So people who have possible exposure and have symptoms of flu-like conditions, might be a good idea to come and see us or go to your healthcare provider and discuss that more.
Wonderful, thank you so much. For the post-exposure prophylaxis, I definitely think that's something that maybe a lot of people in our community don't know about. I mean, even within the LGBTQ community, I don't think that there's a lot of awareness on that. So thank you so much for bringing that up. This next question is maybe more in line with the BRADA or the SISTA program, but do you guys provide any resources available through through mental health? Because I know that when people are diagnosed with HIV or AIDS, there's oftentimes a lot of guilt or things that are happening mentally and emotionally that can impact a person pretty significantly. Do you guys provide any services in those areas?
So our support group is really a place where people that are newly diagnosed or people that have been living long-term with HIV can come together and help educate each other. I think it's really important to understand that there's a lot of questions and concerns when you find out you're living with HIV, that you don't really know where you can go and ask those questions. And so the support group is really that safe place to have those conversations free of judgment, free of people that may not have the experience of living with the virus can give you feedback and give you advice. There's so much new and progressive information around the virus itself, around treatment and around medication, around opportunities and services, that it really is important to help build a network of people living with HIV on this island so that we do have those spaces where we can find that and feel comfortable enough to share that. I'll just share that in our women's support group, which we started earlier this year, many of the women had never had an opportunity to have conversations about HIV before. A lot of them are mothers, a lot of them are working, some of them were born with the virus and have been living with it their whole life. And so they kind of carry on with their lives and just kind of hold it to themselves. And what I learned quickly with this women's group was that it became a place where they could finally talk about sexual relationships, being mothers, caring for themselves while they're caring for their families. They finally found an empowering way to really educate themselves about the new ideas of HIV and what we're capable of doing. I've been living with HIV for the last 17 years. And if you would have told me 17 years ago that I was going to be living and thriving in a health and being healthy and that I would be able to have a family and raise children and doing all these things, I wouldn't have believed you. But now we have the opportunity to share these experiences with other women who may find themselves in similar situations, so that they can really get empowered enough to make sure that they're taking care of themselves, so that they can carry on, take care of their families. That's just one instance of ways of really helping educate the community and helping other people living with HIV educate each other.
Thank you so much for sharing your personal experience. I know that that's not an easy thing to share so openly, and I want to say thank you so much for having the courage to do that and share that with us today, and for being an example of a woman who's out there and just kicking butt every day to make our community better. So thank you for that. To follow up on it, I know that there's some issues that the transgender community faces that are specific and unique to them. And maybe there's even some that are specific to being transgender in a rural community. What are some of the issues that people might be facing, and what are what program areas do you guys have to help assist the transgender community?
Keith, thank you so much for that question. You know, I grew up in Honolulu, and so moving here to Hawaii Island and really seeing the difference between an urban lifestyle and rural lifestyles, it's very, very different for young people coming out as trans and really helping and like navigating their young lives in the middle of a transition. So we're building a transgender services program that really focuses on empowering this person at the individual level, looking at the name change process. We can even help pay for that as well through our affiliation with the Kua'ana Project in Honolulu. Once a person has their name changed, it really, and it says it on their ID, and we can affirm their documents like their driver's license, their birth certificate. It really is an empowering tool to be able to go out and live in the workforce, right? If we are not able to present our IDs and feel comfortable about it, if we're not able to present our legal documents and feel comfortable about it, I'm gonna avoid going to a regular job. I'm gonna go make my money other places, and it may be a little bit more riskier, right? And so I really think that the most important thing about the beginning of a transition is helping someone really legalize their documents and get affirmed in that way. And then there's there's a lot of different hurdles to jump through when it comes to health insurance and receiving transgender health care and really finding the providers that do these procedures to help someone affirm their body. And so through this transgender services program, we're really able to help walk someone through that whole process of finding the right providers. We here at Iola and Kyle and his team can do hormone treatment therapy and offer the services, but there's a lot of different procedures that a lot of trans women and trans men may need to get: augmentations, breast removals, orchiectomies, different things like that, really health insurance companies make it very, very difficult to really kind of like find who, where, and when those can be done. And so you really need someone with lived experiences. And so I think that is one of the major tools that we use here at Kumukahi, is we hire people with lived experiences so that it makes our services easier to kind of more palatable for individuals to come and engage and work with us. Empowering transgender people by affirming their health care and affirming their legal documents is the #1 tool to help them live a less riskier lifestyle through sex work and through other things that we have to do. So yeah, I think that this transgender services program is really just built on whatever that person may need at that moment, identifying the lifestyle and trying to minimize the risks around it. And how we do that is, it can be an individual level interaction. It just really is looking at the person and what they might need.
Excellent. Thank you so much.
And if I could add to that too, since bringing on Kiva, it's been really eye-opening to see, the not necessarily the lack of transgender services, but just how spread out we are and how hard it is to access that. So it's so important to have Rochelle on our team with the medical insurance piece. And also, I think for our folks here, like having families involved, like it's been really interesting to see with Kyle, mothers bring in their sons or daughters for starting that path of walking the true life that they want to walk. And it really provides such a sense of pride for me that we can have that type of space here to have these services available and have people feel comfortable enough to include their family in their journey. It's very, very difficult, especially, Honolulu. A lot of folks are just kicked out, sent to work the streets. And I know on Hawaii Island, we try to preserve our families as much as we can.
Absolutely. It's definitely a challenge, and being rural definitely adds an additional component to that, especially because your main offices are located in either Hilo or in Kona, but you guys said that you do some mobile testing and a lot of mobile services. Where can people find out when you're going to be doing those mobile testings in case they don't have access to a vehicle or transportation to get into Hilo? How can they find out about those mobile services?
Yeah, thanks, Keith. So anybody who would need a service mobile testing we do on an individual basis. So anybody who is in need of testing can call in, or they can log on to our website and fill out the form that Peter was showing earlier. And we would reach out to them and arrange to come to them. Our case managers occasionally go out to the Oceanside area. And our clinic occasionally goes up to the Waimea area. So we're both the clinic and the case managers. And so we really can provide these services just on an individual basis by that person reaching out to us. We are looking to expand and be able to do outreach on a regular basis across the island. Hopefully in the very near future, keeping our fingers crossed and funding opens, we will be able to really expand our outreach and make it a regular thing on a weekly basis in different parts of the island. When I realized that we were spread out over 4,000 square miles of landscape on this island, I realized like, oh my gosh, how do we touch those places that are so far off? And somehow we're able to do it. We have to take the time to go out into those spaces. But I think that that's what harm reduction really looks like. It's like I said earlier, meeting the client where they're at. And if transportation is the challenge, and for a lot of trans people, sometimes you don't even want to leave your home or leave your safe spaces, your safe neighborhood. We have to understand that. We have to address that. And it's our responsibility to provide the service that's wrapped around the client, not the client providing it, making it easier for us to see them. So yeah, outreach is important.
And we're working on getting a mobile medical unit. We just got some funding from the state health department, which we're really excited about. Also, we couldn't do it without folks and their donations. So I just want to make a quick shout out for, if you would like to donate to us, you can either donate to us with this button. We actually have swag that you can buy with our new logo. There's other ways of volunteering and hosting a party with a purpose. So all different ways that folks can support us in the important work we do so that we can get into the community.
That is just amazing. I'm completely blown away that you guys will go and make an appointment to see one person rurally in an area. So it's not like I even have to try and get from the bottom of Hawaiian beaches up into Pahoa. You will come all the way to my house and visit me. That's amazing. You don't get much better healthcare service than that anywhere. So thank you so much for that. That's absolutely incredible. And I know that we're coming up on the end of our hour together. So I just want to turn it back over for maybe one quick last message. If somebody has a takeaway from your presentation today, what is the one thing that you want them to know? And then where can they find more information about any of your services, whether that's through your website, your social media, phone numbers? If you want to do a last minute plug for any of those, please just go ahead and give us a shout out on those right now. So what's your takeaway from today's presentation?
I'll probably let Cindy take that.
So I just wanted to have a moment and just kind of give a little bit of the stigma that, you know, all our departments deal with. So for Kumukahi Health and Wellness, the name change, not only what the group has explained, but, you know, with the 24 years of experience I have working with the agency, the fact that our names in the past, Big Island AIDS Project, Hawaii Island HIV/AIDS Foundation, West Hawaii AIDS Foundation, that really prevented some folks on accessing our services. And unfortunately, HIV and AIDS has that stigma that deters people from seeking care. But the name change to Kumukahi Health and Wellness, I think, broke down the walls for our clients, for our community to come to our offices and contact us and feel safe and know that it's safe, it's non-judgmental, and we will meet you where you're at. So, you know, reach out to us and, you know, somebody from the team, we all kind of overlap each other, but we'll point you in the right direction, hold your hand and just walk you through the process and getting you what you need. Whether it's contacting us through the website, calling our office, you know, coming by the office, but, you know that we're there. We're there to be a part of the community and to strengthen the relationships we have out there in the community.
Thank you so much, Cindy. And thank you. Oh, go ahead.
No, thank you, Keith. We just wanted to unmute our microphones and say together that we are Puna strong.
Puna strong. Puna strong.
We are Puna strong.
Oh, I love it. Thank you all so much for sharing all of your wealth of information and such a special organization for our Puna community. So thank you. And we'll see you all in our next presentation at the top of the hour. Have a great day. Aloha.
Aloha, everyone.
Aloha, everyone. Thank you.